Well, hello, everyone, and welcome to the Events/Center for Faith Partnership as we reach out to our Indiana partners and collaborators. We appreciate you guys joining us. There may be some of you who may be elsewhere, so good morning to you. My name is Conrad Washington. I am the acting director for the VA Center for Faith and Opportunity Initiative, and it is an absolute pleasure to reach out to you and have you all join us. So thank you again very much, and I appreciate it. What I want to do first is share with you that here at the Center of Faith, we're excited about all the things that the VA is doing, specifically to our partners in the faith-based community. You see my bio there. I'm not going to read that, but I will share with you the part of my journey as a retired, has been a retired Marine for 20 years. Retired in 2009, and I went over to OIF in 2004. Now I'm a licensed minister preaching, and so it's just a privilege to be here in the Center of Faith and being able to reach the center of the faith-based organizations. And I have my colleague here who's working with me, Will Morales, who's also a Marine, a combat Marine. He's handling the things behind the curtain. So we should have a very safe and worry-free webinar today. So thank you all again. So without further ado, let's go ahead and get started. I want to introduce to you Dr. Barbara Van Dahlen. You see her bio there. I'm not going to read the entire bio. We're going to leave it up for you to peruse. And actually, I will read it, I think, because some of you may be calling in. So she took over. President Trump signed the executive order, the executive order 13861, which is the Prevents Executive Order, which was created to have a task force to coordinate efforts across the government and to build a national strategy focused on improving overall mental health and prevent suicide. To lead this multi-agency national effort, Dr. Van Dahlen was selected as the executive director of the Prevents Task Force. She was named to Time Magazine's 2012 list of the 100 most influential people in the world. Dr. Van Dahlen is the founder of Give an Hour, a national nonprofit that provides free mental health care to those in need, including service members, veterans, and their families. Dr. Van Dahlen led the organization as president until 2019. She's a licensed clinical psychologist who practiced in the Washington, D.C. area for over 20 years. She received her PhD in clinical psychology from the University of Maryland. So she's homegrown in our backyard right here, back in 1991. And I will add to that bio that I know her very well. And it's a pleasure to have someone who is not just a clinician, but actually understands that faith actually does play a role in the resiliency of our veterans. So Dr. Van Dahlen, the floor is yours, ma'am.
Thank you, Conrad, and thank you for the opportunity to partner. I love partnering with your office. We are in lockstep when we think about the power, the importance of the faith-based community and helping to reach people who are struggling, who are in pain, who are suffering. And so this is a wonderful opportunity. I want to thank all the folks on the line who have joined today. Thank you for taking the time to learn about Prevents. I'm going to talk about the work we're doing. I want to do a couple of things before I do that. I have some of my other key staff members on the line, and I'd like them each to just introduce themselves briefly so that the Indiana community understands who will be working with folks in Indiana going forward. And I could not be more proud and more just impressed with the dedication, the service of these men and women who have stepped up to serve the Prevents Task Force, and these three folks are great examples. So I believe I've got Liz Barnes. I believe I saw your name. This is a different format than we've been doing meetings all day yesterday and today, and this is the first WebEx that we're doing, so I'm still learning where I look to see things, but I believe that Liz Barnes is in fact on the line. So Liz is the Deputy Executive Director for Prevents, and I just would like Liz to introduce herself. Although she may be muted. If that's the case, then she may not be able to speak. Is that right? We may not be able to hear from her.
That's right, Dr. Miller. I think the attendees.
This is Liz.
Oh,
can you hear me?
Very good.
Perfect. Thank you so much, and appreciate the opportunity to introduce myself. I've called in as well, so thank you, Conrad or William, for allowing me to talk through the computer. So I'm Liz Barnes. I'm the Deputy Executive Director, and I've been with the Prevents team for about 2 months now, coming over from DOD and the Defense Suicide Prevention Office, where I wrote policy and did strategic planning. But I was also in the Army for 9.5 years and have been part of DOD for 21. Very much appreciate all that you do. Thank you so much for attending today, and really excited to be able to work with the state of Indiana because we cannot do this alone. So thank you for what you do each and every day. Thank you, ma'am.
Thank you, Liz. And I see that Chris is on as well. Can we unmute Chris so that he can introduce himself?
I believe I'm unmuted. So good morning, everyone. Just a quick sound check. Can you hear me?
Absolutely.
Wonderful, wonderful. So I am Chris Olson. Some of you have heard me speak on the previous calls. I am the Prevents Director for State and Community Partnerships. One of my most recent roles I had working for the VA's Veterans Experience Office for Veterans Families and Community Engagement. So I've spent the last 4 years really working with our communities, helping to build up that capacity and collective impact initiatives. And so this is just a fantastic opportunity to kind of take some of that experience and continue to build on that as we move forward together with our communities, and as we'll talk about today, especially with our faith-based communities. I'm a Navy Special Forces veteran, so the topic of suicide and suicide prevention has touched me both personally and professionally, throughout the community, and I'm very, very passionate about this and very excited to work with all of you. So thank you for being here today, and Barbara, thank you for the opportunity.
Thank you, Chris. And I have one more, William, if you can unmute Crystal White. She is also with us today. That's the last thing I will ask technologically of you besides running the program, but I'd like Crystal to introduce herself.
Hello, good afternoon. Can everyone hear me?
Yes.
Awesome. Thank you so much. Thank you, Dr. Van Dahlen, for the opportunity. Thank you, Conrad, to you and your team for so graciously hosting us and helping us pull this together. I am super excited, especially to connect with this group of individuals. Again, my name is Crystal White. I serve as the Director of Integration for the Prevents Task Force, and just finished or just completed at least 20 years of service. So that includes my active duty Air Force time, working for some time with the DOD. I managed the TRICARE office over at Rama Air Base in Germany, and then with my VA time. So as some of you may know, suicide prevention is very near and dear to my heart. I lost my dad to suicide a few years ago, leaving behind my 5 brothers and sisters. There's 6 of us total. So that was an absolutely earth-shattering moment for me personally and for our family. And if it were not for my faith, I would not have made it through that time, and I would not be here with you all sharing in all of this goodness that we're producing. So again, super, super excited about being a part of Prevents, and especially connecting and engaging with our faith-based community, since we know that that's a protective factor. I can absolutely speak personally to that. So thanks again so much for the opportunity, and I look forward to our continued partnership in the future. Thank you.
Thank you, Crystal. So I like to introduce my team for a number of reasons. I think it demonstrates the level of experience and expertise, but more importantly, the passion. And this is what Conrad and I think, share this passion for reaching those men and women who are suffering, and we know that our faith-based communities do such incredible work in this space. So before we go into the actual presentation, and then we will save time for conversation at the end, we have a special video, a special greeting. One of the things that Prevents has done, so our work is to literally prevent suicide nationally. And in order to do that, we have to do a lot of different things, and I'm going to go through those different things and what we're doing. one of the ways that we believe we can be most effective in reaching those who are hurting is to make sure that we have spokespeople, ambassadors, champions. They can be at the community level, they can be at the state level, they can be local, or they can have a national platform. And so we have launched a ambassador program, and we have 18 national ambassadors already, and we'll be moving forward with state ambassadors over time. Our lead ambassador happens to be a Hoosier, and an amazing woman, and such a champion for the work we're doing through Prevents. And Second Lady Karen Pence is our lead ambassador, and everything we ask her to do, she says yes. And she has been out talking about this work. She will continue to do that. And when we told her that we had chosen Indiana as our first virtual state visit, we asked her if she would create a video, and of course she said yes. So before I tell you more about Prevents and what we're doing and how we're doing it, we'd like to share a special video created for you, for our Indiana friends and colleagues, by the Second Lady. So William, if you would.
Hello, fellow Hoosiers.
Thank you, William, for showing that. And I will say that we know that Conrad's team is amazing. You always do such great work. And we have shown that video in using other platforms, and that's the smoothest so far. So even though it wasn't perfect, I think it definitely conveyed a lot better than we've seen on some of the other platforms. So thank you for that. And also, it's very clear from the Second Lady's words how passionate she is about this work, and how committed she is to helping us and those who are struggling and hurting. Last thing I want to say before we launch into the actual presentation is I want to give a shout out and thank Dr. Doty for all of her work in helping us put together the conversations, the panels, the meetings. I know that she is well known in the community, and I believe she may be on this call, but wanted to thank her for all of her hard work helping us have 2 amazing days of really meaningful, productive, important, valuable conversations with our colleagues and friends in Indiana. So, William, we'll go ahead and get started now on the formal presentation. And so we are PREVENTS. PREVENTS is the acronym, stands for the President's Roadmap to Empower Veterans and End a National Tragedy of Suicide. Next slide. Next slide. So this is our agenda. We've already made it through the various introductions and the video. So now I'm going to do the presentation of the official, background information on PREVENTS. Next slide. So for those of you who aren't familiar with PREVENTS, PREVENTS was created, that we are the outcome, if you will, of an executive order that was signed back in March of 2019 by President Trump. It was signed in order to create a plan, a roadmap that would lead to the prevention of suicide. It established a 3-year effort known as PREVENTS, and we are the first of its kind, the first ever all of government interagency task force, but it's also whole of nation. So our work is focused on engaging and working with every agency in the federal government, but also with our partners, our community partners, faith-based partners, our corporate partners, our academic partners. And when I accepted this position, I had been, prior to this position, as Conrad so beautifully shared some pieces of my background, I was leading a nonprofit organization that provided free mental health care to those who serve in their families for 15 years. And we had been working on also changing the culture around mental health in our nation, because as we know, people are very reluctant to share their emotional pain and suffering, and they're reluctant to talk about mental health concerns. So when I stepped into this position, I was honored to be asked and shared that it seemed to me that the only way that we would be able to tackle suicide and ensure that we prevented suicide in the veteran community was if we tackle suicide more broadly, because suicide is a national tragedy. We have seen an increase in suicide in over 30% in the last 25 years. As you heard the Second Lady say, it is the second leading cause of death for people aged 10 to 35, which is just frightening and shocking and very disturbing. And so our effort, our focus with PREVENTS, although we have a specific focus on reaching our veterans, the broad public health messaging is for everyone. So my office sits between the Department of Veterans Affairs and the White House. I answer to both, and they are the 2 co-chairs for the task force. The executive order that led to the creation of the task force is a 3-year effort. The first year was to create the roadmap, which we have now done. And then the next 2 years, we are focusing on implementation and evaluation. As I mentioned, there has never been anything else like this, cabinet level, interagency, all of nation effort to address any mental health challenge, and certainly let alone suicide. So this is audacious, it is aspirational intentionally, it is massive public health focus, but we have already seen that our nation is ready. We have seen so many partners, national level, state level, community level, stepping up to work with us. Next slide. So here's our approach, our philosophy and our approach. So as I said, the roadmap has been created with one mission in mind: to end a national tragedy of suicide for veterans and all Americans. The mission is complex and audacious, but it is achievable. With the launch of the roadmap, we are telling the nation that we can prevent suicide by changing the culture around mental health and suicide. We don't talk about these things. We didn't used to talk about cancer, but now we do. We don't talk about what works for us, what we have found to be helpful in terms of mental health or emotional well-being. We don't talk about mental illness, even though, again, we talk about all variety of physical illnesses. So we need to change that. Second way that we are going to prevent suicide is by emphasizing the importance of collaboration. We cannot do this alone. We can't get there on our own. No organization, no entity, no sector can. This is a all hands on deck, all organizations, all walks of life, everyone must be involved in this effort. We need to elevate champions and empower leaders because they have the platform and they can reach people who are struggling and hurting. They can reach people who look like them, who sound like them. We need to make sure that this is providing opportunity for people who have themselves struggled and healed, find their voice and share their perspective. And we need to make sure that we're elevating champions who have identified solutions and innovative approaches and effective treatments. We need to identify and amplify those solutions. And finally, we need to involve everyone. This program and this effort and the public health messaging, it is for everyone because anyone can be at risk. Next slide. So when I took the position, and for those of you who like to build things, I think you'll appreciate this, because I'm a builder. I'm a clinical psychologist. I didn't know I was a builder until I had I was really compelled to create Give an Hour. It was, 9/11 happened, and I wanted to help, and I couldn't find a way to give my time, and so I created a way for me and other mental health professionals to do that. And I have come to understand that one of my passions is to find solutions and build them for challenges that I see, especially in the mental health space. So when I came in, and we had a number of folks, because it's government, who wanted a logic model, and that's great. Logic models are great. And so they suggested, a standard one that is very linear, it looks at a straight line. But as we kept talking, I think they eventually gave up because they realized that that's not how I think about preventing suicide. This is something that these things that we're doing, they have to happen and integrate and happen simultaneously and continuously. So this is our strategic framework. Prevent suicide is at the beginning. And around that, you can see the different elements and aspects that will drive that culture change and seamless access to care and enhancing the research ecosystem and robust community engagement. And then as you go out from the center, you see eventually that ring of people, because we are engaging everyone in this effort. And then finally, on the outer ring, our institutions, our faith-based communities, our government, our corporations, our academic institutions. So this is how we believe we will prevent suicide. Next slide. These are some of our major milestones. We've had many in the short year that we have been in office. We're approaching my 1-year anniversary. So as we started to work on building the roadmap, we engaged over 129 VSO, veteran service organizations, and military service organizations to work on this with us. We worked with over 150 stakeholders, subject matter experts, all of the federal agencies. Before COVID, we had state visits and town hall events in communities. We visited 5 states and then had to pause. And now, as I said, Indiana is our first virtual state, and we're going to continue. We created our website where you can actually read the roadmap at va.gov/prevents. We now launched our ambassador program, and in addition to the Second Lady, we have another famous Hoosier, the Surgeon General. Dr. Adams and I work very closely together, and he's been an amazing ambassador as well. We have Facebook and Twitter accounts, and before as we stopped to focus on COVID, before we finalized the roadmap, we really were quite concerned about the impact of COVID on mental health around the country. And so we launched a campaign called More Than Ever Before, which is a companion to the big public health messaging campaign we're launching next week, and more than ever before, encourages everyone to pay attention to their emotional health and well-being, to practice what works for them, to reach out to others who are struggling and suffering in their community. And then lastly, we published the roadmap. It's available to read. It's very tight, 60 pages, and there's also an additional 300-page document that is a supplemental material that supports the roadmap. Next slide. So I mentioned COVID. So we knew that we needed to do something. As a mental health professional, I was very concerned, and in fact, we've seen surveys that have indicated, a tremendous increase in our country in anxiety, in indicators of domestic violence, substance use, depression, and so we're already seeing indicators. And so as soon as COVID emerged, prevents shifted our focus. We continued to work on the roadmap, but there was an urgent need to focus our efforts. So we launched more than ever before on March 27th. And have continued that. I've done, I think, 85 videos. I made the commitment to do one a day just to share little nuggets that can help people make sense of what they're experiencing or where they might find help and support. We've been collaborating with our federal agencies and state agencies and community efforts. And so we want to offer, if there's anyone on this meeting that wants to share what you're seeing in terms of the impact of COVID, or innovations, efforts that have launched in your communities, we would love to hear about those and would love to invite you to share those with us. Chris Olson's email is there, and you can send that information to us. Next slide. So we worked with over 150 subject matter experts, as I said, all the agencies, and at the end of that process, it was quite a sausage-making process. We came up with 10 recommendations out of 150, huge collection of 150 recommendations, and we sort of looked at all of them and realized that they could all be nested into 10 broad recommendations, and those broad recommendations seem to fall into 4 strategic areas. So the 4 strategic areas are communications, research, programs, and policies. And you can see there's 1 specific recommendation for communications, 2 for research, 5 for programs, and 2 for policies. I'm going to talk a little bit more about that in the next slide. And then how we're going to do that is all those subject matter experts and all the agencies are still very much involved in our work. And we have various working groups, and we have a data action planning group that helps sort out how to ensure data is shared. We have an implementation working group, an evaluation working group. So lots of work is going on behind the scenes to move this massive effort forward. Next slide. Faith-based communities. We know that our faith-based communities serve as an incredibly important protective factor for suicide. Faith-based efforts have been found to be effective in the prevention of suicide. Over the past 50 years, research has consistently demonstrated that high levels of participation in a faith-based community are associated with lower suicide risk and rates. The suicide risk for people who never attend religious services is 5 times greater than those who attend a faith service. So this is really important information that we are grateful to have amazing partners like Conrad and his office and many of our community partners. We are excited that one of the efforts that we have coming up, and I'll put this in a calendar for you in a few more slides about what we're doing next week. Next week is Prevents Week, and one of the events that we're hosting is, again, in partnership with Conrad and the White House, is a faith-based roundtable for some of our national leaders in the faith-based community. And we're going to do what I'm doing here, which is briefing on Prevents and the roadmap and what we're doing, and on our public health campaign, and asking them to help us the weekend of July 25th, 26th. It actually will be the weekend of the 24th, 25th, 26th, because there are Friday services as well as Saturday and Sunday, as we know. And so we'll be asking our faith-based community to help us by building in messaging into their sermons and discussions, and we will provide talking points that are consistent with our public health messaging, because we know that congregations around the nation are already involved in these conversations, some that haven't yet want to be. We know this is an important conversation to have anytime, but now more than ever before, it is such an important conversation to have because people are struggling and may not know the risk signs to look for in themselves or others. So that's coming on the weekend of July 24th, 25th, 26th. Conrad is going to be, or he has been, very much partnering with us to help get the word out. We would really appreciate your help. We can, as I said, we'll send information to you so that you can help push that opportunity out. And then we will amplify and elevate and share broadly the good work that's being done. As more people in the United States are encouraged to seek help for emotional suffering, many turn to faith-based leaders, and we want that. And we want to make sure that our faith-based leaders are equipped, that they have the information that is helpful to them to have those conversations. Creating partnerships between faith-based leaders, mental health professionals, and community members will be key in developing effective interventions that support improved mental health and suicide prevention efforts across communities. Future support engagement from faith communities will be necessary to promote overall community health and well-being. So we know that you all believe this, support this, promote this, and we're very proud that through our efforts, we will be as well. And we look forward to partnering with all of you. And thank you in advance for your help and your commitment, because together we really can prevent suicide by working together. Next slide. So back to the specific elements to give you a little bit more in-depth understanding of what we're looking at across these four. So to review, we have these 10 overarching recommendations, and each of those 10 fit under one of these sort of strategic areas. Our aspiration, our mission is, as we know, will prevent suicide within the veteran community and lead the way in preventing suicide for all Americans by employing a public health approach to empowering every individual through a nationally driven, community-implemented, four-part integrated strategy. That's a mouthful, but it is exactly what we're doing. The first area is the communication campaign. So how will we know what success looks like? So we want to, and we already have, develop and drive a national public health campaign. We have it developed. We're going to be launching it next week. How will we know that we're successful? We'll know when there is a strong awareness of risk factors for suicide and the adoption of help-seeking behavior among all communities and veterans in particular. So we all have risk factors for different things. Most of us know our risk factors for some of the health issues that maybe run in our family, or maybe we have a risk factor because of something that we were exposed to. I'll give you an example of one of each for me. So I know I'm at risk for heart disease because my father died of heart disease. Both my brothers have had heart attacks. So I know that it's imperative that I take that very seriously. So I watch what I eat, I exercise, I get regular checkups. Also, a few years ago, I was foolish and I got on an airplane when I had a really bad congestion and sinus infection, and I literally blew out one of my eardrums. And the doctor grounded me. I couldn't fly for a few months. But what that did is it now has created, I have a very high risk for hearing damage. And so I have to be really careful and mindful of that. So I have risk factors. I pay attention to that. Most people have risk factors for mental health challenges, and many people have risk factors for suicide. Anyone can be at risk for suicide depending on what happens to us in our lives, what our genetic factors are that we inherit, but most people don't know them. And how can we protect ourselves from something that could kill us if we don't even know we're at risk? So that's what we're looking for. And along the way, we will build a culture of openness, support, and belonging around suicide and mental health more broadly. Okay, that's the communication campaign. Research. There's a lot of great research out there. We want, through Prevents, we want to prioritize precision suicide intervention research and enhance the federal research ecosystem, and outside the federal research outside the federal system as well. So we're partnering outside of government and inside government to look at how do we get smarter? How do we do more focused research that helps us understand how one intervention or one effort to reach someone works better than another might for a different person. So for example, what might a 70-year-old veteran respond to, male veteran respond to in terms of outreach or intervention compared to a 25-year-old female service member who may be struggling? So how do we move more toward that? And then how do we promote just a more open, collaborative, coordinated research ecosystem, collection of programs and efforts? And when we see those things happening, we know that we are on the right track. For programs, what we're doing is launching we want to scale data-backed programs at the community, local, and state levels. So there are so many good programs out there. We need to make sure that we are tracking the good programs, gathering data, information sharing, passing on best in class, information to other efforts so that they can learn from each other, best practices in general. And what our goal is to have a streamlined program access to comprehensive end-to-end mental health and suicide prevention care for all, with a specific focus on veterans. This is a good place for me to pause and say that our public health approach, our public health messaging is for everyone, all Americans, because we can't, first of all, even if we wanted to only focus on veterans, we can't do that effectively. If we could have done that, we would have already. We would have basically said, okay, any veterans who are hurting, please come in and we'll get you care. We have to change the broader culture. And by the way, we are seeing 47,000 Americans die by suicide each year, and we need to address that. So that's the public health campaign. The messaging campaign is for everyone, but the research focus, the programmatic focus, and then the policy work is more focused intentionally on our veterans and our service members who will become veterans. So the programs that I'm talking about, those, although they will inform and help civilian-focused programs, and we will work together with, these programmatic and research efforts are veterans-focused. So back to the program, we also want to see more suicide prevention initiatives and conversations in the workplace, in schools, and faith-based communities, and other stakeholder organizations. So we're all working together, and people have knowledge that can help them when they're hurting. And then finally, on the policy piece, we're not, Prevents is not here to lobby specific legislation. We're here to hold up what good legislation should look like in order to meet the goals of this effort. And so we're working with members on both sides of the Hill and in our local and state efforts to promote good legislation. And also, we want to see policies at the university level, academic institutions, with corporations in state and local government that increase access to care and provide additional support for people who are struggling. Next slide. So these are the 10 recommendations. I am not going to go through them all because I wanted to talk more about the buckets that I just did. These are the specific recommendations, and you can certainly ask me about any of those or send us follow-up questions. You'll find more about each recommendation on our website in the actual roadmap. But these basically, when you look at them, you go, yep, that's what she was talking about. So there's 2 for research, 1 for communications. Next slide. 5 for programs. There's one here that I'll make note of because I haven't said anything yet about this area. So the 5th recommendation here is to increase implementation of programs focused on lethal means safety, voluntary reduction of access to lethal means by individuals in crisis, free, inexpensive, and easy, safe storage options. We know the research is very clear. If you build in space and time between an individual and their chosen lethal means, you prevent suicide. And if you build in that time and you break that intention, you stop them from getting to whatever the means were that they had intended to use, they are unlikely to choose a different method. And so what this tells us is everything we can do to build in that space and time. This is not about in any way infringing on anyone's Second Amendment rights or talking about taking weapons away. This is about encouraging safety, safe storage, and not just about firearms, but also medications and poisons and bridges. It's very important, and we have had great bipartisan support on this. We've worked closely with DOD on this and the VA and a number of organizations working on suicide prevention. So we're very pleased. We've heard from both sides of the aisle, so to speak, that we have struck a good balance here, that everyone can agree how we can move forward. Next slide. And then the policies I mentioned before, you know, the looking for additional, eventually we'll be looking for additional federal funding to support programs in communities. Right now, what we're doing is actually surveying what's out there, what's possible, where the gaps are, so that we can build additional opportunities for communities. Next slide. This is Prevents Week is coming up. That I sort of did a little foreshadowing. So July 7th, next Tuesday, we are going to release the National Public Health Campaign at the National Press Club in Washington. It will be a hybrid event where we will have some people in the room, a small number of folks directly connected to the task force, but then we're live streaming it. So we will share with you through our partners here the link so that if you want to watch the event, you can. It's from 1 to 2 o'clock on Tuesday. Secretary Wilkie from the VA will be speaking. Second Lady Karen Pence will be speaking, and the Surgeon General will also be speaking, and then there'll be a panel discussion. It'll be a really great event on the 7th. On the 8th is the Faith-Based Leaders Roundtable that I mentioned. That will be virtual. On the 9th, we are holding an event with the Chamber of Commerce focused on a second signing of a Well-Being in the Workplace pledge. We've had 30 companies have already signed on, and we're very excited that this will be another group that signs on. And they've created a workplace guide that we'll be able to share with companies all over the country for free to help companies increase and improve well-being in the workplace. And then additional events, as I mentioned, that weekend, July 24th, 25th, 26th, we want to see as many congregations, as many communities as possible across the country spreading the word about prevention, early identification, risk factors, practicing what is effective, maintaining their connection to their community, to their faith. So that's coming. And then we'll continue to build and move forward with our various partnerships. We'll do an event with the Department of Defense as we approach Suicide Prevention Month, which is in September. And we'll continue doing these virtual state visits until we can get back on the road again. But these virtual visits allow us to bring in people from all across the state, which is great. Normally we would visit a state, have 2 or 3 or 4 days, you know, and you can't really get to everyone. But so we'll be doing these, and we plan to get to all of our states over the next 2 years. Next slide. So this is our Prevents Pledge. So one of the things that we hope that you will help us do is promote the pledge. This pledge is not a heavy lift. It is asking people to learn about risk and protective factors, making a commitment that they care about ending suicide, they care about changing the national conversation about mental health and suicide. that they're willing to talk about suicide and use safe messaging practices, that they're willing to initiate conversations, seek opportunities to volunteer and help, and spread the word. And we have all kinds of resources. You can find the information now on our va.gov/prevents website. This pledge will morph next week. It will change how it looks. It will take on a slightly new name as we reveal. It'll be the big reveal on Tuesday at the Press Club, because the Prevents Pledge will take on a piece of the public health campaign name. And then we will have, two different ways to push this pledge out. But we hope that you'll help us share this, and we're happy to talk about how we can use the pledge in the context of some of your other work, and how different efforts can become Prevents partners that help us push things out. Lots of opportunities. This pledge is really important. It gets people to make a commitment to do something, to learn these things, and to push themselves to talk to people who may be suffering. Next slide. So just some other things that we would love to have your help with. So again, on that, especially that weekend of 24, 25, 26, and we are working closely with Conrad, and he's going to help us create some talking points that we will push out. We would love your help in encouraging other faith communities in sharing this messaging over that weekend, sharing the messaging of Prevents at conferences, meetings. Again, we have lots of resources that we can provide, and I know Conrad's going to talk about some more specific resources as well. We are doing a mapping initiative that allows us to add in information from communities, from states, and so we'll reach out to you. Normally I would ask my deputy to talk about it, but in the service of time, I'm just going to say that we'll be sending more information to you about it, so that we can show how much is happening in Indiana and how much is happening in the faith-based community. As I mentioned, legislative work, if there are things that you think we should know about, we would very much appreciate hearing that. We also are about ready to launch a survey to our veteran community to learn from them and help guide us and lead us as we move forward with Prevents. Chris normally would talk a little bit about that, but I'm going to do that right now so we save time for Conrad and then the questions and the question period to make sure we answer all of your questions. But you'll hear about that from us, and we would really appreciate your help pushing it out to your communities, because we know there are many veterans who are in your communities. That's coming in July. It's a survey to help us understand our veterans' experience in communities and what they believe could be helpful to them. Obviously, we want you to help us continue to push out the public health campaign once it launches next week. And we are also launching a state proclamation effort. We have a state proclamation. It will be up on our site next week. It will be the state proclamation request. It goes into each governor's office, and we would love your help once and we'll let you know once we are now loaded them all in, and so each governor's office has this request. It would be great if any of you have connections to the governor's office and can encourage the governor's office to support this, because what we'd like is all 50 states and the territories to sign this proclamation. We're focusing on September is Suicide Prevention Month, and September 10th is World Suicide Prevention Day. So we're hoping to have a signing on the 10th, a virtual signing. And so we'd love your help with that, and we'll share more as we launch that into the states. And then to continue doing the good work that you're already doing, the collective impact efforts that we see in our states are just tremendous, working with service members, veterans, families, caregivers, and survivors. Next slide. This is our social media. We did not add our Facebook. It was an oversight, so I always ask Crystal to add into the text our Facebook page, so you can follow us on Facebook as well. We've been very active on social media and happy to share and tweet and repost good information that you send us as well. And then the last slide. This is our contact information. So we're here and happy to hear from you. Karen Migdale, who's not on this call, is getting ready for the next week's events. But if you have a communication question, then she can respond to that. And so with that, I'm going to stop. And however, Conrad, you want to do the next piece, it's back to you.
Okay. Thank you, Dr. Van Dahlen. Great information. And I appreciate you taking time to join us and share the Prevents initiative with Indiana. And I would just caveat that I know I have a lot of faith leaders. I see some colleagues out there. I thank you guys for joining us today. And let me just clear up a couple of things here. So I know that some of you had questions in the question box. I'm gonna hit those so that we can have either Dr. Van Dahlen or myself answer. So again, if you have questions, on the bottom of your screen, there's a little, looks like a little man with a face, the old cartoon that you can click on, it will turn blue. That will give you the opportunity to type in questions, right? And then I will ask the question to Dr. Van Dahlen. But I do have one here. It says, in a current secular environment, how will this interfaith initiative play a role? Will faith leaders have a passive or active role in suicide prevention from a faith-based perspective? I can chime in a little bit. Dr. Van Dahlen, would you like to chime in as well?
Absolutely, but go ahead, Conrad. You and I have had these conversations, so this one's making me smile. So please do, and I'll play support role. Yeah.
So it's a vision that Dr. Van Dahlen and I have. We're working in helping people and serving, because that's what we're doing, right? We're serving. We want to be able to, gather all of the faith organizations throughout the nation from an ecumenical standpoint to play a role. And that role consists of many things. Some things could be having a suicide prevention coordinator, right? That's an SPC that the Department of Veterans Affairs provides, and there are over 150 of them throughout the nation. And we can have that within your organization at any time. Just reach out to us, and I'll give you. I have a presentation after this. It'll be very brief, but it will tell you how to do that to connect with us here in the Center of Faith. Then also, Dr. Van Dahlen just gave us some great information regarding va.gov/prevents. Go to their website. There are a lot of tools and information that you can use that's applicable. So not to get personal, but I grew up in the church, right? And I know how the stigma of suicide is in the church. We don't talk about it, right? But we need to change that, just as we did with cancer many years ago. And Dr. Van Dahlen uses this example, but it's true. 20 years ago, cancer was something we just didn't talk about. But now we can talk about it because it's okay. We need to get comfortable with the same thing here when we talk about suicide prevention, especially in our faith-based organizations, specifically the churches and mosques and cathedrals, to let people know that you're not alone, because faith is defined as things hoped for, evidence not seen, and it translates to hope and resiliency. And so we say faith, but it also translates to hope. And so we want to give people hope. We do that by offering them those protective factors, and faith is a huge protective factor, especially in those communities, rural areas, because people need to know they have something to lean on. I'm not going to stop. I'll keep rattling on, but please chime in.
Well, I think that's beautifully said, Conrad, and I think that's why we have this great partnership with Conrad and his office and so many of our faith-based leaders, because we know the importance of faith. We know the importance of community. We know how our faith-based communities are so front and center in reaching out to people who are struggling, who are in pain, and it is often the combination of factors that leads someone to healing. It may be that the faith-based the resources in the faith-based community for them, it may be that is in fact enough for that individual. But it may be that is a piece of a larger overall plan for their overall health and well-being. It may be that seeing a mental health professional is a critical part. But again, one strengthens the other. So we see this as very much the pieces of the larger puzzle, going back to the strategic framework that we have. These pieces fit together because, and I used to say, or maybe I said this in this presentation. Forgive me. Sometimes I'm not always tracking. I love sharing what I think could be helpful to bring things to life, but sometimes I may bring it to life twice. But if I didn't say this before, when I started this work, I came into the government, not being of the government. And so I work in a different way. And I had to say this multiple times in meetings and to staff, if you really don't like messiness, if you need things to be sort of, linear and piece by piece, this probably isn't a great fit because people are messy. Humans are messy. And there is no one size that we can fit everyone. We know that. And so that's why we need all pieces to be available to be part of the conversation. So hopefully that helps at least understand our philosophy and our perspective of working together.
Absolutely. I love what you said about people are messy, and that's not pointing the finger to anyone because we all are messy. And some of the challenges is we need more people to roll their sleeves up and get messy with people so we can all get clean, right?
Absolutely.
That sounds like a sermon title, but anyway.
I like that.
Yeah. So if you have questions, please type them in the Q&A box, right? My colleague, William Morales, told me that I need to talk into the mic so that there's no echo, so forgive me if I'm varying. To cover a couple of administrative things, I know that when we showed the second lady's video, some of you could not see that video. We want to let you know that we will send that video out. Is that okay, Chris and Sandra and Dr. Van Dahlen? I think that's okay for us to send that to them.
I think that would be very nice. Yes, I know that the second lady, as long as folks just don't share it broadly because we haven't. But I think Liz, unless you see a reason why we shouldn't, I know that people would like to see it as it's supposed to run. So Liz is on mute, but Liz, what do you think about that? Oh, she's not on mute now. Oh.
Can you all hear me?
Yes.
Perfect. No, I think that it sounds good. Just with that disclaimer, please don't send it out widely.
Yeah, I think unless we have permission from her, we don't want to do that.
Exactly.
Yeah.
Looks like we have another question here. I'm trying to, from Mark Smith. It says, we have been teaching risk and myths about suicide in the military for 30 years. Audiences could recite them before we did. How are we improving that message for greater success?
Well, thank you, Mark, for that, the question. And at some point we should compare, sort of the how, and I'm curious about the myths, and that's great to hear. I think what's different, we hope, is, first of all, I think that a lot of Americans do not know about risk factors or protective factors. Most people do not talk about suicide, and most people continue to have believe in the myths around suicide. So we know there's an interest, and we can see sort of different indicators of that. Just in I mentioned the More Than Ever Before campaign, and I recently did, as we're heading into this, we launched the roadmap, and so I did a couple of the little videos focused on myths, and they received a tremendous amount of interest. And so while the military may, which I think is great, I know this has been an important focus, and I've worked with DoD and the VA for 15 years. And in fact, we know that our veterans can help lead the way because they have been exposed, they have heard these things, but the country doesn't talk about these things. We don't talk openly about these things. And most people do not yet engage in proactive behavior as a result of them. And so they may intellectually know them, but it may be that by changing, well, not it may be, we believe that by changing the culture around everyone, it will become the way that, as Conrad used cancer as an example, that we now talk openly, we celebrate when people heal, we have events that showcase people's journeys. It's completely changed the culture, and we have seen culture change in many, many different ways. We can point to things and say, well, this is something that people used to be afraid of. But just to point out, the people still worry, still. And you say, you talked about how I've been teaching, absolutely. But I recently had someone, government leader, who was concerned about, if we talk to people about suicide, aren't we potentially giving them the idea? There's one of those myths. Answer, no. But people still think things like that, or they think, that if somebody intends to kill themselves, there's nothing you can do to stop them. That's not true. Also, we know that many people who have made attempts but do not die talk about how they didn't want to die, they wanted to end the pain. So I think we have a lot more work that we can do, and hopefully bringing it into the broader culture. I hope and expect that our veterans will be able to take pride. We have seen this. I'll give another example. So in our work with one of our, and this was my work before I joined the government, and we've continued this partnership now that I'm inside, one of the large VSOs that I worked with when I was leading Given Hour is the VFW. And the VFW a few years back decided that they wanted to be, as Brian Duffy said, the point of the spear. He was the commander-in-chief of the VFW at that time. And he wanted to be he said, we should be the the point of the spear in educating, using our posts for, proactive social engagement. It was really great. And they started partnering with my organization to teach people the signs of emotional suffering. And he started sending me story after story after story of how these veterans began reaching out to each other, recognizing the signs of emotional pain, noticing that somebody was sort of deteriorating emotionally, and they before wouldn't have known what to do with that. So I think there's still room, and I think we still are pushing the cultural shift. We'll know we're there when people start talking about the first time they have a suicidal thought, and they say to someone else, ooh, I just had this thought. What do you think of that? Or should I be worried about that? Or I'm a little worried about that. Or, that we'll know that we're making the shift when people recognize way early before they're at the point of crisis and can no longer think rationally.
That's good. That's right. You're absolutely right. And I'll add to that, Mr. Smith, that if you want to have more information on the myths and so forth regarding suicide prevention, that's part of that brief that I talked about with our suicide prevention coordinators. Again, there are 150 across the nation. So if someone calls and says, "Hey, Conrad, we would like to have a suicide prevention, brief in Colorado," we can make that happen. That's what our office does. So please reach out to us. We can do that to gain more information. But if you have additional questions, I'm trying to observe here. Thank you, Will, for putting that Facebook link for prevention in the box there. We can also send that to you guys as well. Again, after this brief, we're going to provide, after the presentation, we're going to provide you guys all kind of information that will be helpful to you.
We'll bombard you.
I'm sorry?
I said we'll bombard them with all kinds of fun stuff and hopefully
yes.
useful information in ways that you can follow and join us.
Right, absolutely. That's what it's about, equipping people to do what we do to affect the veterans. We can go ahead and start the presentation. I'll only be a few minutes because we covered pretty much all of it. Well, let's just go ahead and I'll kind of run through a little bit, just give people information. You can keep going. Next slide, yeah, just keep on rolling there. Yeah, so we're going to talk about a couple of things about the Center of Faith just for visibility. Go ahead. Next slide. Yeah, and so that's our mission. I'm not going to read it, but again, we partner with faith-based organizations ecumenically across the nation, and the partnerships vary. We're going to talk about that in a little bit, but the intent is to get every faith-based organization connected to two things, and that's to community services and to veteran services, and that's what we're excited about doing. Next slide. A little history of the Center of Faith. We began back in 2004. Most recently, 2018, we were reestablished by a White House executive order. So again, we've been here, there, and I'll talk about how many other agencies there are here going forward. Next slide. 13 federal agencies have centers of faith, so we're not the only show in town. And I see I have a few of my colleagues and partners on the line there. Kevin Smith, thank you for joining us, and some others. So we work closely together. We have meetings, dinners, and so forth, a lot of different initiatives. We went to Puerto Rico together a couple of years ago to do some great work out there. And so, you know, whatever information any of you need in Indiana, any one of us can help you, whether it's, you know, Mike from agriculture, whatever, we can make some things happen for you. Next slide. Some of the partners, you know, again, just an example of the partners we have. I don't have them all there. I missed a whole bunch of them. Forgive me, but just to give you an example, we partner with anyone who has a veteran program so that we can, you know, amplify that program, connect them to VA services, connect them to community services, so that we can equip them to better serve the veterans in their organizations, whether it's a church, mosque, cathedral. We want to partner because, as we know, veterans don't have a denomination. In our view, veterans are veterans. And so it doesn't matter what color they are. We want to serve them so that they can be on line with their purpose that they have. Next slide. A couple of PSAs we did, didn't mention all of them, just a couple. Salvation Army out there, that was a great experience. K-Love, a great experience, and I can talk about that, but it's good. Again, just promoting VA's stance on connecting faith to the services that the VA provide. Next slide. So the executive order that was signed, that it reestablished us in 2018, I put the bullets there. Those are some of the things and initiatives that we focus on. In addition, as you already know, suicide prevention, VA homelessness. So we want to make sure that, again, our faith-based partners and who we collaborate with understand that there's a wealth of information for them to use in their communities. Next slide. So I pulled the religious data. Just being a center of faith, we have to share this because we need to know that, guess what? Here's an example of the nationwide religious affiliation with our veterans for those who actually submitted information, right? And so obviously Protestant is always the largest area, and then we go to Catholic, and then you can see the breakdown there. I'll just kind of give you a visual of where we are with our religious affiliation amongst our veterans. Again, this is only for those veterans who actually self-reported. Next slide. And I took the liberty last night of pulling Indiana's data. Now, the source that I have there is actually May of this year, so it's not 2019. It's pretty recent. I just didn't update that little piece there, but it's from our Center for Veterans Analysis and Statistics, and it's great information. But again, it's the same. That's what Indiana looks like right now, of those veterans who self-reported, right? So we can kind of see what it looks like here. Next slide. And this is the overall across the nation. We have the veterans per capita, but we also have the veterans information across the nation. As you can see, California, Texas, and Florida are heavy states for veterans, but we don't exclude any other states, obviously. But we're excited about getting to those areas for our veterans. You know, even in COVID-19, with what we're doing now in regards to the webinars, we're still effective, and the effectiveness comes with partnering with organizations across the nation. Next slide. Some of the accomplishments from the Center of Faith, again, we're not really patting ourselves on the back because it's a team effort. And as Dr. Van Dahlen mentioned, what we're doing here in conjunction with all the Secretary of VA priorities is working together with different areas across the board. And we can't do it alone. When we talk about suicide prevention specifically, as mentioned before, we cannot, the VA cannot do it alone, nor can you. I've learned a lot of things, you know, being in the Marine Corps. Some of you probably laugh and don't hold that against me. I've learned that when we work together, great things can happen. And so that's what we're trying to do here, is just collaborate and make a stronger effort. And those are some of the results of what we've been doing, working with all of you all out there. Next slide. And here, I had to give a little plug for recent initiative. I'm excited about it. It took many years for this to happen prior to me even joining the office, but I'm excited that it's actually in the works here. And this is how to start a veteran ministry. You can see what that looks like briefly there. And basically, we want you to, start a veteran ministry at your organization, a welcome center. And it can look very differently amongst each organization. And you can see Bible study, fishing, Starbucks coffee, whatever it is. We just want to connect with veterans. As a veteran, I know how veterans think. For the most part, we just want to talk, we want to connect, and they may not be affiliated with a denomination, and that's fine. But we know that once they connect with people who are of faith, some great things happen, and I'll leave that alone. So if you want to get connected to us to create a veteran ministry, we have a pocket guide that's on our website, and I will give you a link to our website once I'm done bumping my gums here in a little bit, and you can pull it out, you can download that pocket guide and connect with us. And the whole purpose of this pocket guide is to connect each faith-based organization to VA services and to community services. I know I sound redundant, but that's really what we're all doing in the arena of veterans. Next slide. Some pictures here of us in Nashville. That's Dr. Ben Graham, Pastor Ben Graham, the late Billy Graham's grandson. He's out of Lebanon, Tennessee, right outside of Nashville. Actually had an opportunity to preach at his church, but then we also had an event there. Great work they're doing there. You can kind of see us collaborating and doing things. To the left there, you see the mobile unit. So once the COVID is over Indiana, and you guys want the Center for Faith of the VA to come out to your area, we can do that. And I will have my team schedule the mobile unit. We can house it with a counselor who's trained, and we can bring that out as a great tool, but also it can impact who's in the area. So let us know. Next slide. Some more pictures of different events that we had. At the bottom, you can see there how you can help in donating. And in our documents that we're going to provide you afterwards, we're going to give you a sheet, a fact sheet, not just with my office, but a fact sheet for the homeless office. And it's going to give you guidance on how to help veterans. Sometimes through the HUD-VAST program, some of the veterans may be able to get a place to live, but they need starter equipment, i.e. utensils and pots and pans. Those are the kind of things that churches and other faith-based organizations can do to make that transition easier for our veterans who are homeless and get housing. Next slide. So here are our objectives. You can read them. I'm not going to read through them, but the bottom line is we want to connect with every faith-based organization across the nation. We want to make sure that when a veteran comes out of uniform and they go back to their hometown, that organization has something for them that's connected to the VA. And I have a dream, a vision, whatever you want to call it, that if we can have a welcome ministry or veteran ministry within every faith-based organization, our veterans can have a home to go to and know that they're being supported by the local community and by the Department of Veteran Affairs. Next slide. So I'm done. Hopefully that was brief. Hopefully we didn't lose so many people there. So there you have the information. The bottom is our website. We will give you this information when we send the video out of the second lady and other documents, as well as Dr. Van Dalen's presentation. So you can click on it, download our pocket guide, and whatever you need. And contacts are there. Please reach out to us with any information. We're here to serve you so that we can serve our veterans, their families, and beneficiaries, because it's a lot going on, and there's 20 million veterans out there, and we need to reach all of them. And we want to partner with you guys. Next slide. I think that's it, right? Yeah, I think that's it. So if we can put Dr. Van Dalen's slide back up with her contact information, well, I appreciate it, just so they can kind of see that information again. Thank you. So if there are any questions here, hopefully didn't lose any people. I see some people here. It says here, if not engaged already and once advertised, will it be permissible to reach out to local religious organizations to brief this to clergy? So when we say, will it be permissible to reach out to local religious organizations to brief this to clergy? Absolutely. Share the word. Share the word. Share the information. Absolutely.
And this is Barbara again. For our purposes, please do, especially when we send out information about the hope for July 24th, 25th, 26th. We would love for that to go out far and wide, and we'll be sending out talking points so that people will have tools that they can easily use and share with others. And we're hoping that it will really help our faith-based communities add to the good content that they already have that they're providing. So please and thank you.
Yeah, so Barbara mentioned that in July, we're going to ask faith leaders to mention some suicide prevention in their sermons. And so I will share with you, I'm going to coordinate with Dr. Van Dahlen and help provide a couple of sentences, and we're going to edit that to provide to you, and I will send it out to you. But I also want to kind of share with everyone on the line before we break that next Wednesday, July 8th, right? Next Wednesday, July 8th at 2 p.m. Eastern Time, we will have another webinar. And Dr. Van Dahlen, would you like to share more about that webinar?
Sure, that's the round table that I mentioned, or we're calling it that because it'll be a big table.
Yes,
It is virtual, and we will have Secretary Wilkie with us. There will be some other special guests, we believe, will be joining us as well. And it will be an opportunity to talk about the public health campaign, the messaging, how we're going to be moving forward, working together. So similar to this conversation, but even, I think, a little bit more honed in on the messaging and why it's so important to engage, how to engage, sharing the messaging and how these pieces fit together. And again, we look forward to having Secretary and I think another special guest or two will join us.
That's right. And so everyone know that's going to be nationwide. That's not just exclusive to a specific geographical location. That's going to be nationwide. So again, that's next Wednesday, July 8th at 2 p.m. And we will send invites out to you all, a flyer, because as you signed in today, you should have given us some information, right? And my team will send that flyer to you. We hope and ask that you share that flyer with all of your colleagues so that everyone can join the call and get more information.
Absolutely. Do we know, Conrad, how many people can fit on that? I'm just curious. How much does technology allow?
I want to say it's 10,000, right, William?
Oh.
Yes, sir. The current structure that we have for VA for WebEx allows us to have participants up to 10,000.
Wow.
So there you go. So
we'd love that.
Yeah. Share it. It'd be great.
Absolutely. Share it. Any listservs that you all are part of, drop it into that stream, and it'll be a great opportunity to, again, lift up this shared mission. And Conrad, I just, again, want to thank you for all that you do and for our partnership. It's really because of you, Conrad, that we Prevents will soon have a designated staff person. It's because of my work, so that everybody knows what I started working. Conrad and I met each other when I first came into this position and started talking about the importance of the faith-based community and the Prevents work. And as I've been building the positions and creating positions to expand the team, it really is because of the work with you, Conrad, that we have added a position that will specifically focus on the integration and coordination with the faith-based communities across the country. So thank you for inspiring many, and in this case, inspiring me, and for all of your help.
Thank you, Dr. Van. I appreciate it. That's very kind of you. But you know, to leave private practice and to be a part of the government is not really normal for most people. You had a very lucrative business. And so I want to thank you for serving, in this capacity, because being in uniform, a lot of times we experience things and when we come out, there's a transition. Will knows this, and so does Chris and many of you on the line now. It's a challenge sometimes, and so it's great to have people who care. And I'm always impressed to see that a clinician like yourself who believes in faith is just such a phenomenal thing. And so I'm excited about what's going on, and I'm glad I'm participating in it. So let's get it done, right?
Absolutely. And thanks to everyone who's on this call for all that you are doing in your communities. And please let us know how we can help.
That's right. So with that being said, I have nothing else for anyone. I don't see any more questions. I want to hold you all up. Thank you very much for joining us. And we look forward to you joining us next Wednesday, July 8th at 2 p.m. Eastern. You'll get that information. Thank you, and be blessed, everyone.
Thank you.